Hello, Cara. What a pleasure to finally get an opportunity to sit down with you and ask you a couple of questions. It's been a long time coming, and as the matriarch of APPF, I think it's fitting that we do sit down with you. I'm really interested to hear your thoughts on audiology, but more than that, just an opportunity to get to know you as well. Who is Cara Hoffman? And so I'm really excited for this one. I want to introduce you, and everybody that's watching, I want you to listen carefully because, and unfortunately, it's going to be a long introduction. So, but really interesting. Cara, you concluded your undergraduate studies at UCT. You then did your master's at the University of KZN, focusing on the rehabilitation of hearing impaired children. You then received your clinical doctorate from ATSU. That's a private medical school in Arizona, USA. This included a wide range of fields in clinical audiology, including auditory evoked potentials, tinnitus, genetics, auditory processing disorders, infection control, ethics, wax removal, outer ear pathology, etc. You also have additional qualifications in cochlear implant mapping, and you completed your LSL SSA auditory verbal course with Warren Estabrooks. And then somehow, I don't know if it was during all this or after that, you also managed to have 3 children. And you are currently the practice owner of, or part practice owner, Thompson and Hoffman. So, wow, that is a mouthful, Cara. You then started your, or in between as well, had your career where you started off, also worked in private practice. After that introduction, please just tell us, how do you find the time to do everything that you are doing? I'm sure all the APPF listeners and anybody that's watching this, if I can just sketch some background from what I perceive Cara to be, she's almost like a superwoman. She seems to find time, even though she seems to find time for everything, her work and her family. Okay, Cara, so during you also in your work history, you started after community service, you started working in private practice. Tell us a bit about your career and how it led to opening this practice.
Thank you, Sevran, for that wonderful introduction. Thank you. And so I think when it comes to time management, there are a lot of balls that we're juggling. My husband always tells me that I have to have 8 balls juggling all at the same time. And it is bound to happen that 1 or 2 balls get dropped. And then when we are able to identify which balls have been dropped, then we pick them up again. But that's the aim, is that we are constantly looking at the different satellites in our lives and compartmentalizing it. So when it comes to having the time for my patients and my practice, then that is the set time that I focus on my practice. And then I generally end work by 3:30 during the day. And then so by about 4 o'clock, I'm home and I'm being a mom and a wife. And I try to not have the influence of work in between there. But of course, now since APPF became part of my life, I do end up doing a lot of things at home as well, but I've managed to make sure that my email doesn't come through to my phone, which might seem quite archaic for most people, but I found that that's been a lifesaver for me and a sanity container, I suppose, so that I don't get emotional or riled up or have any reaction during my personal time at home when it comes to work and business. So I think that's how I've maintained the boundaries. And I've also been quite firm with my patients And some of them enjoy that firm boundary and some of them don't. And the ones that don't generally go see Lauren because she has no boundaries. I love you, Lauren. So I limit my relationship with my patients in terms of email or telephone conversations from the office only. And my personal cell phone number isn't given out. And so I end up not having the overlap as much as I used to. It wasn't always like this. I used to have my email on my phone and I was permanently connected to everyone else except for the reality of what's happening in the here and now. And as I think I've matured and developed and grown, I've realized that everyone, including the children we have, thrives on boundaries. And so it's all about just setting the boundaries that work for you. And it's not to say that what my boundaries are going to be the same as everyone else's, but I think that if you look at your life and take a snapshot of your day or your week, you're able to quite easily compartmentalize tasks and stick to that. And that's what keeps me sane. So that's just with the juggling act. When it comes to my work history, so I actually didn't really want to do audiology when I finished school. I wanted to study medicine, and something in me just decided to apply for it was speech therapy and audiology as the dual qualification. And I didn't think I was going to get in, and I was quite immature at that stage anyway. And I got in and I thought, well, now that I'm in, I may as well study. And so after the first year, and I didn't really enjoy it, I thought, well, I've passed the first year, I may as well continue with the second year. And that's what happened until I graduated. And I only really became passionate about audiology after the year of community service. So when I started working in private practice and having a connection with other human beings. And that's, I think, what the main thing is with audiologists in general, is that we want to have a connection with another human. And working in private practice has allowed all of us, but it's allowed me to make connections with other people and to learn and grow with our patients. And that's what I think I've enjoyed the most about audiology, apart from all the various clinical aspects that one either likes or dislikes. I think the bottom line is that we connect with other humans. And at the end of the day, whoever leaves the office, I should be feeling good about what I've done, and they should be feeling good about what's happening to them. And if we can get that right, then I think we'll all be very happy.
Well, that's really interesting that you wanted to study medicine, because your hunger for being a doctor didn't stop there. So even though you went on with audiology, you got your clinical doctorate. Cara, so that's inspirational in itself. And even just coming back to boundaries you've set in your professional life, I think that's really valuable. And it just goes to show the amount that you still get done, even though you've set those boundaries. It's not influencing, you just work really effectively with your time. So that's really good. And it's also for other audiologists watching, maybe that is a tip to having a business partner with you that's also an audiologist, like you mentioned, maybe somebody that you can share the load with. So Lauren, well done for taking those patients that Cara sent your way. Cara, so give us an idea in audiology or in your practice, what is your clinical expertise? What do you enjoy? Who do you enjoy seeing?
I'm very passionate about pediatrics. And so I enjoy everything pediatrics in terms of electrophysiology, so doing ABRs. I don't so much enjoy going into theatre, just because you're always waiting for the previous case to finish or for the child to get registered or to come into the theatre. So it's always long, and then it ends up that I'm having to cancel patients that are booked afterwards at the practice. But other than that, I very much enjoy pediatrics. Lauren and I both worked at a very big diagnostic practice before we opened up our own practice, and that had a very, very strong pediatric focus. So that's where we learned our tools and tricks in terms of doing condition play audiometry, visual reinforcement audiometry, and where I learned how to do an ABR. And so that followed us a lot, because the referrals that came in that other practice, when that practice closed, came our way. So we've enjoyed continuing with pediatrics when it comes to diagnosis and management of, and it's generally, we see a lot of profound hearing impaired children. And so that then flowed very well into the additional licensing in cochlear implant. And for a short period of time, I was assisting with the coordinator role of the Durban Cochlear Implant Program. So I was working quite a lot with a lot of implanting surgeons and audiologists that want to become trained in cochlear implant. So I've very much enjoyed just the management in terms of being able to offer profoundly deaf individuals or people that do not benefit from hearing aids with another option. And the technology is just absolutely brilliant to work with cochlear implants, and to see those outcomes is just magic. So that is two of my favorite areas of practice that I really enjoy and I'm really passionate about. Early intervention. At one point in our practice and in our career, we were doing quite a lot of newborn hearing screening, but we decided also in recent years to pull out of doing that in the hospitals, because we find that it's quite a stressful situation for moms who often don't even remember what's happened, and the nurses who give inaccurate or inappropriate feedback. We found that tended to unravel a lot of moms. So we've pulled back from newborn hearing screening, and we prefer then for those pediatricians or ENTs who are concerned about babies to refer them after, say, 6 weeks for assessment and hopefully diagnosis nice and early. So, but that was a nice big area of audiology that we also enjoyed.
Cara, I've got a lot of respect for pediatric audiologists. I think it is a really emotionally tough field to work in, but really rewarding as well. In terms of cochlear implants, if there is somebody from the public watching now as well, can you maybe just give an idea the criteria for having a cochlear implant has changed quite a lot over the years, and with funding nowadays and so forth, it's much more accessible than it used to be. Can you maybe give some idea if somebody themselves have a family member or they themselves have heard about a cochlear implant, or they've been advised that it's maybe the next step, but they are still quite anxious about it? What advice can you give them?
Thanks, everyone. That's such a great question, and we get asked it a lot by family members as well who phone in and inquire. So I think that is an area that people are interested in. The first thing to note is that yes, medical aids in general do cover at least a big portion, if not the entire package of the initial implant, and that's where a lot of parents or hearing impaired prospective cochlear implant users, they think they focus on the initial device and the surgery, and they think if that's covered, then they're great, they're in a good position, which is the first step. But by no means is having a cochlear implant a cheap method or management of hearing impairment. And there is a lot of, especially if it's a child, there's a lot of maintenance that's required. Yes, the kits that they get do cover a lot of spares, depending on the kit that they get. So both or all the companies will have various tiers of kits, depending on whether the patient is able to pay in over and above the medical aid rate, or they're unable to. So they're able to get a pretty basic but standard kit at the medical aid rate. But they forget then that the follow-up and the rehabilitation and the mapping, and if it's a child, additional school requirements are steep. And so we always encourage our patients that they should have at least 10 to 15,000 Rand saved per year to manage that implant, especially for the first year. As the user becomes less dependent on needing adjustments, so their need for seeing someone becomes less. but you can't predict that at the beginning. You never know how someone's going to really do. We do a whole lot of pre-implant assessments to make sure that we're going to have a good outcome. But at the end of the day, things happen, and so sometimes a person that hasn't had as good an outcome that we expected would need more rehabilitation, will need more mapping sessions, and so it does become costly. The nice thing that the companies that we deal with have offered and continue to offer is that anyone that is getting an implant gets what they call like a maintenance plan, and it's valued to around about between 10 and 15,000 rand, depending on the company. And that money is not given to the patient, it's not given to the practitioner, but it's kept in the company, in the company that supplied the implant. It's kept there for the person to be able to buy against. So if they need parts, or if they would like certain audiology appointments or mapping sessions or ENT appointments to be paid for, it can be paid for from there. So it gives them a little bit of a springboard to assist in the beginning stages. But over a period of time, that also dries up. And so it is important to have devices insured. Insurance is not cheap for cochlear implants. And to constantly make sure that you've got enough spares, because it always happens that at the end of the year, between December and January, when everyone's closed, that's when the majority of recipients tend to have problems with the devices, and then they can't get hold of anyone. So we've got the responsibility towards the end of the year to start contacting our patients and to let them know, to check if they've got spares, and to make sure that they are well backed up. So that's when it comes to sort of the management of cochlear implants. For someone that's hesitant, and this is something that I think is it's very important to engage the person on why they are hesitant. And I've just done this IDA Institute, inspired by IDA course, and it talks about the line, the circle, and the box, right? So the box is very useful even for a prospective cochlear implant user, because you're looking at someone who is ambivalent, and you've got 4 boxes, and you've got advantage, disadvantage, advantage, disadvantage. And you go through with them, what is the advantage of staying the way you are now? What is the disadvantage of staying the way you are now? What is the advantage of changing, so getting an implant or getting a hearing aid? And what is the disadvantage of changing? And often we can get to the point where the patient then realizes, well, it's up to them at the end of the day, but let's try and tackle what those concerns are. Sometimes it's a surgical concern, and most of the time it is. People don't want to go and have an operation. And so it's a lot of counseling that comes into working with prospective implant users. And some of the best outcomes that we get is when we just introduce an implant user to a prospective user, and they get to ask each other questions. So that's also what I would recommend. And then in terms of guidelines, yes, the guidelines have changed a lot. And the one important thing that I think audiologists don't realize is that there's no upper limit, age limit on implantation. So if you have a patient that is 90 years old and not able to follow a conversation and has a poor quality of life, but everything else is okay in terms of general health and their ability to withstand a surgery, they are still an implant candidate, a cochlear implant candidate. So that's one important thing. And the minimum limit of age on implantation is probably, with the youngest we've done is about 9 months old, but I think internationally they'll implant a 6-month-old, all depending on their weight and general health. So that's sort of age. And in terms of function, so yes, we look at the pure tone audiogram, but as we all know, that's not the be all and the end all. And Renee did a beautiful webinar yesterday about speech reception and speech recognition, and we do what we call speech perceptual testing, which is very similar, but it's in sentences, words, and syllables. So we'll look at how a person is functioning on a daily basis. And generally now, they'll look at a word recognition score, sentence recognition score of anything worse than 70%, they'll be an implant candidate. Whereas in the past, 50% or worse, or 40% or worse, was implant candidate. But now, because of the because of the number of years and experience that surgeons and audiologists and engineers now have in implantation, they will implant quite comfortably someone that is not doing, that's doing worse than 70%. And especially now, since they've brought out electroacoustic stimulation, which is a combination of a hearing aid and an implant. So they put a full implant in, but they may only activate certain electrodes, say, for example, in the high frequencies, and you use an acoustic component for the low frequencies if they've got a precipitous loss. So that combination has also been a game changer in terms of those people who were sitting on the borderline, kind of doing well with hearing aids, but not really coping in noise. And so that's also been a big game changer in terms of what we can offer patients.
That's really good and really promising, I think, also for the future of hearing healthcare. I mentioned it's emotionally tough working with a pediatric population. I'm very curious, maybe this is not related to the pediatric population, but the most difficult thing in your career thus far, what has that been? What's been the hardest thing for you in audiology?
There've been a couple, and I think a lot of them have been major learning curves, just as a human, as an adult. Maturation is a big thing. And also having kids has changed the way that I deal with other parents. So one that sticks in my mind is a child who we had diagnosed with a profound hearing loss via an ABR, but the mother was a doctor, and she happened to have walked into theatre. I'm not sure why, but she walked into theatre and she saw those impressions under the ABR machine, and she completely freaked out that I hadn't given her the feedback, appropriate feedback. I hadn't even finished packing up the ABR machine, but the ENT that was doing it with me ended up giving the mom feedback, and it all sort of unraveled from there because I wasn't the one that gave her the feedback, and she felt that it was a slap in the face to have been to see these impressions without her knowing the diagnosis. So that was one really tough one, and she had said that she wanted to report me for unethical and unprofessional behavior, and it was really a tough time. And you want to retaliate, you really do. You want to defend yourself because you don't have ill intentions, but at the end of the day, it's always someone's perspective, and you can't change their experience and the emotion that is attached to that experience. So that was really a tough one. And another one that we also a pediatric, a single-sided deafness, and Lauren will remember the story, and we were quite young, quite new in practice, and we ended up telling the mom that she had some options. You know, she had an option to have a Baha, and she had an option to wear a cross, and she had an option to have an implant. And we were going over all the options for this mom, thinking that we're doing something good. And next minute, this mom just burst out crying. She couldn't cope with this information that we had given her. And that's another thing that is interesting, and it's maturational for us. It's developmental as human beings, is that sometimes we have to wait for someone to absorb the information before we just throw all the management options at them, and we want to fix it. And sometimes they're not ready for it to be fixed. They're wanting to absorb the diagnosis. And as clinicians, sometimes we're uncomfortable with someone just sitting and crying in the room, and you want to be able to give them all the options that they need, and they know that they're going to be fine. But at the end of the day, we still have to remember that they're human beings, and their moms or their dads or their parents, and there's a process of emotion, and very often dealing with pediatrics, it's still the messenger. So I've had to do ABRs in a different room, in a different office, in order to give a feedback in another office, so that there's not that negative connotation of this awful event that has happened in their life, and they connect me to that. And very often I've had to refer to a colleague to say, look, I've done this diagnosis. It's not they don't have a good feeling about being here. They had a negative experience. not necessarily because of what anyone did, but they have an associated memory of a negative experience, a traumatic event, an emotional time in their life, and they just cannot face coming to me. So I'll send them to someone else. And that was also, I think, part of the learning curve when it comes to pediatrics.
That's why I've got a lot of respect for pediatric audiologists. That's quite interesting. Yeah, I've never thought about that you make the diagnosis and say, look, because it's been such a traumatic experience, let me refer to a colleague to take the rehabilitation over from here. That's quite good, and yeah, shows maturity, I think, in your career as well. Was there a moment in audiology where you ever felt, this is it, I don't want to go on, or I want to give up, but then there's been something that inspired you to continue?
There have been moments. There have definitely been moments where I've said, I'm throwing the towel in. One of them was we had a drive we had donation hearing aids, which were brand new actually, that we had a drive to have a little competition and get the public involved. We wanted to encourage involvement and awareness for hearing loss in children. And at the end of the day, anyone that was voted, we had planned that we were going to give them something anyway, whether it was an ear mold, whether it was a battery, whether it was a hearing aid, we were going to do something for everyone that was voted in. But then there was a complaint to our professional association, and then I got gunned down for putting our profession into disrepute. And I was really very, very offended and very hurt. And I thought, well, if this is not what we can do, it wasn't for marketing purposes, it wasn't to boost my practice, it was to encourage people from the public, someone that needs help, someone that needs a hearing aid, to get help. But it just totally backfired, and it was a very negative experience. And that's when I said to Lauren, it was a couple of years ago, and I said, I'm done. I want to help people, but I can't do it like this. So that was a tough time, definitely in my career. And also moving from being an employee to being self-employed, that was also a period of time where, previous employer had put in place a restraint of trade and a whole lot of threats about stealing their information and stealing their patients and their database and trying to be sued. And that was also a very negative experience and quite stressful, when all you want to do really is be an audiologist and not have to deal with the legalities of work and employment issues. So that was also a time where I was just thought, is there a point? But there have been many, many, many more positive experiences in my career to have reminded me that I am passionate about what I do, and that not everyone is going to get along with everyone. And that's why there's more than one audiologist on this planet. It's because you resonate with different people, and that's also okay. It's okay. And I've grown pretty thick skin over the years. And if someone comes in and says that they don't want to see me, or they want to see Lauren, and the opposite, if they don't want to see Lauren and they want to see me, we used to become very offended and upset. What have I done wrong? And at the end of the day, it's not anything that we've done wrong. I think it's just a personality that's, as I say, it resonates with some and doesn't with others. I think the point in my career that was a light bulb moment was most definitely starting with auditory verbal therapy and parent guidance, and watching the progress of these children who were not completely nonverbal, and learning 2 different languages or 3 languages, and mainstreaming, and just seeing that progress that can happen is very fulfilling. But it comes with hard work. But that definitely for me was one of the major highlights in my career, starting to see that we actually do make a massive difference. And it's not just with pediatrics. I find that hearing aid users, they benefit so much just from having that little extra, come for a cup of tea, come and chat, having a relationship with their audiologist that has fulfilled my life. And so it doesn't feel like I'm doing a job every day. It just feels like I'm connecting with people and hopefully helping. So that's been the turnaround for me. And I must say, running a practice is is only as good as your front office staff. And if you've got a good team in your admin staff, then I find that that's half the job done. And then obviously having a partner or a business partner or a colleague that you're working with that gels well with your personality. It doesn't have to be the same personality, because I think that would cause clashes. But I certainly feel that if you have the correct personalities within your workspace, it makes such a big difference.
That's really good. And yeah, I think audiology is all the better for it that you opened up your own practice. I can definitely see that, you know, I didn't know you obviously before you open up your own practice, but I can see that when you now are a business owner, that I can see from you a good deal of assertiveness, which I think is really necessary being a practice owner as well. A level of assertiveness, but Cara, it's definitely not lost the passion that you have for people and the passion that you have for audiology. So that's really evident. In that light, so Cara, I want to know, you mentioned a level of maturity, so we're going to come back to that. Advice that you would give your 21-year-old self?
I think I would say, don't take everything so personally. Don't carry the world on your shoulders, and don't internalize everything as being your fault. You know, I think that would be, and that comes with the maturity, I suppose, as we're going along. But my 21-year-old self would want to hear that audiology is definitely the career path of choice, and that it's the right choice for me, and that I must continue to follow my dreams, which was to get a doctorate. And I was able to get that. The aim was to get it before I had babies, and I got it done. And so that's what I would have probably told myself, is do it earlier and get it out the way. But yes, that's what I would say, is don't internalize everything as being your fault.
That is really, really good advice. You mentioned the AIDA Institute a couple of moments ago. And one of the things I enjoy a lot about APPF as an organization is the upskilling. What would you say? I think, first of all, just a message to audiologists watching this. You did that AIDA course. How important is it nowadays? If you think I'm doing best practice, I know it, I don't have to go and look at other documents or brush up on the latest research, because I know I'm doing best practice. What would your advice be in terms of further research? And then maybe afterwards we can link some of the resources that you go to, Cara. I think that would be really interesting for other audiologists watching this as well. So yeah, first of all, your advice just in terms of keeping up to date with changes in audiology and new research.
So that's the thing about audiology. It's this changing landscape that everyone's talking about, and it changes like with hearing aids, the same as with cell phones and computers. So if we haven't updated our knowledge, then we are moving backwards. So we have to continue to update our knowledge. And I think that, well, from the AIDA Institute, to be honest, I thought at first, what are they going to talk about that we haven't already heard or learned many, many times? And I think that, yes, some of it is repetitive, but it's great to have a refresher on how to connect with people. And so the tools and resources that they are freely downloadable are so simple, but so beneficial in terms of having that refresher on how to work with someone who is ambivalent or unsure or in the pre-contemplation stage of thinking about doing something. How do you connect with that person without, because my young audiologist self would be saying, I can't believe this person just doesn't want to get hearing aids. It's crazy. They've got a hearing loss. and have an argument with them about it. But at the end of the day, they're at a different phase and a different stage. And so we are not there to dictate. And that's the same thing that we learned from auditory verbal therapy and from working and parent guidance with parents of hearing impaired children. I'm the facilitator, but the parent is the therapist. And it's the same thing with adults as well, and with guidance and with counseling. I'm just the facilitator. I can tell you, I can click buttons, and I can put devices on your ears, and I can make sure that they're working well, and I can give you all the advice that you need, but you actually need to do the hard work yourself. And if you are not convinced that you need to do the hard work, that hearing aid is going to lie in the drawer. And we know that this happens all the time. So it's to allow that power to be regained by the person that has come to ask you for your professional opinion. It's not about us imparting our knowledge or our opinions onto another person. It's about us imparting our knowledge about what happens when we do it, what happens when we don't do it, but how we connect with a human being to find out at what point they're at. If they're not ready, then we can facilitate all we want, but they're not ready. And so, yes, we can try and get them to be ready. And that's where those tools from the IDA Institute come in. So that's why I said, like, the box is a great tool, because then they are physically writing down the answers and they can look at it. And if the only reason why they don't want to get a hearing aid is because of how it looks, then there's a whole lot of things that we can do to fix that. It's just about identifying what's holding that person back. So that was your first question about keeping up to date. And then also being part of APPF, it has been wonderful in terms of the upskilling opportunities, not just the courses and webinars that are being offered, which are brilliant, but it's also been about camaraderie, connecting with other professionals around South Africa and asking questions and learning from each other. You know, in the past, audiologists would stick to themselves. I've got my own marketing drive and my own referral base and my own patients, and I'm going to stick to what I'm doing. Now, it's a completely different ball game. I can pick up the phone and say, Sabrent, I've got this patient. Can you help? What do you think we should do? And we've changed and evolved a lot as a profession in terms of connecting with each other and upskilling just by asking the questions and just by learning from each other. But the drive for offering best practice is great. But as we know, best practice protocols change over the years. And so we were talking about speech discrimination yesterday, that we don't call it speech discrimination anymore. So the terminology will change. And the more we learn about the human ear and about anatomy, the more we will adapt and change. And so I think that we have to learn, and we have to keep learning. Otherwise, if we don't, we're going backwards.
I think an audiologist can fall into the trap so easily when you think of not necessarily, well, let me say this, when something's a gold standard, you often forget that can change as well. And so oftentimes you think, oh, okay, that's the gold standard. And you know, even though that is best practice as well at the time, the best practice can change, and therefore the gold standard as well. So yeah, that's really positive and inspirational as well. Cara, why the heart for independent audiologists? What is it for you? Why is there value in that for you?
So thank you, Sabrent. That was a great question, because the first thing that I want to say is that the public, I don't think, know, firstly, what an audiologist does, and secondly, that there's a difference between someone that's independent and someone that's not. So what we've always had so much pride in with regards to audiology is being able to offer patient choice, and not just choice on device or not choosing a device, choice on how much time they would like to spend with us. Because from what we hear on the international spectrum, those that are involved in over-the-counter hearing aid sales or selling online or selling in shops and retail end up needing to have a significant number of people coming in and out on a daily basis in order for them to turn over hearing aid sales. And that has been for me the biggest game changer in terms of what an independent audiologist is able to do for you, not just in terms of a hearing aid sale. And I would like to remind the public or inform the public, educate the public on what an audiologist is that we spend 4 years learning about the ear and the vestibular system and the hearing organ. And maybe one module of that 4-year degree is hearing aids. And of that module, I don't know about you, Sabran, but I remember having bags of analog hearing aids, and the lecturer said, go and test all these hearing aids out in the test box and see if they are working or distorting, or move it around with a little screwdriver and see which ones are working and which ones are not. That's basically what I remember about hearing aids in varsity. And the rest, I remember monitoring ototoxicity. So TB patients, we spent a lot of time with those patients. We spent a lot of time with learning disabled children, especially hearing impaired children, and monitoring their hearing in schools. We spent a lot of time understanding the anatomy and physiology of the ear and the brain. And we spent a lot of time understanding how to accurately assess and diagnose hearing loss with all the different tools and equipment methods possible, and also learning about how to engage with another human being and the psychology around it. So I would like to enforce and highlight the fact that an independent audiologist is not a glorified hearing aid salesperson. An independent audiologist is going to see you for who you are and look at you holistically. So whether it is, and this upcoming certified dementia practitioner training is going to make a very big difference to our practices, where we can identify those patients who are possibly showing some cognitive decline, and we can engage with family members and other neurologists and other referral sources in order to holistically treat and evaluate that patient. But it is about understanding their auditory vestibular system and where an audiologist would fall into that person's life. So a little example of, say, this patient that I saw this morning. He came in for tinnitus retraining therapy, and we sat for an hour and a half. I didn't even look in his ears. And when he left, it was positive. He was excited, he was much less stressed, and he had a plan. And I didn't even look inside his ears. So that is what an independent audiologist will do. If you go and see someone that's not an independent audiologist, they will sell you a hearing aid. And just like Keith Darrow calls them widgets, the widget doesn't dictate how well someone's going to do with that device. A device is a device is a device. Yes, they'll have various levels of technology, and some will be high level, some won't be, some will offer different things. But at the end of the day, the person will do well when they are supported by the professional that is assisting them. And that's what an independent audiologist is for me. It's being able to look at what is that person doing? Why have they come to my office? Why have they sought help? And especially someone that's come for a second opinion, why have they come in for a second opinion? Because they want to hear something different. And that's what an independent audiologist is all about. It's about listening to you. And if it means spending an hour and a half with you just to talk, that's what it is. It's not about a sausage factory of hearing aid sales.
That's really good, Cara. I want to thank you for using your time that you have and your passion for audiology, and really putting in the effort with APPF. I think audiology as a whole in South Africa can be really grateful for the time that you are putting in. And it's not just you, there is a whole team, of course, but because you are spearheading it and driving it just in that capacity, I think I speak on behalf of everyone in APPF to just say thank you very much for the time that you're putting in. And it really stems, and one can see, it really stems from your passion for people and your heart for people, and wanting to make sure that people receive the best hearing care possible. So thanks in that regard. We really appreciate it. It's been fantastic talking to you and getting to know you a little bit more personally as well. Not just seeing the hardworking business Cara, but also seeing the personal side. And I want to thank you for the time that you've put out so that we can talk to you. I think it was really, really valuable.
Thanks, Brand. It's such a pleasure. You know, I didn't have a plan to work this closely with APPF and with management, and it did just happen, and it was a traumatic tragedy that put me into this position. And I think about Frances Slabber all the time, and we were actually talking about her the other day and just saying, I'm sure she's all around us, and really happy and proud of how APPF is evolving and how we as independent audiologists are starting to really work together. I just wish that she was around to see it, but it is such a pleasure working with every single one of you and getting to know you all and helping. And I'm here, not to say that anyone else is any less capable of helping, that every single one of the members and management are all there and available to help each other. And it's nothing less for me. I'm very happy to help wherever I can. So, and thank you for your time, Sabrant. I'm really enjoying these interviews with you and working closely with you as well.
Thanks, Cara. Great chatting to you. And yeah, I'll see you next time for our next interview.